KSJE is supported by the Farmington Civic Center, bringing a full slate of entertainment to Farmington and San Juan County. Romantic music with the 10 Tenors, Friday, February 21st at 7:30 p.m. The Farmington Civic Center, 200 West Arrington in downtown Farmington. Find out more online at fmtn.org/shows or at 505-599-1148.
Good morning, everyone. I'm Megan Cullop, along here with Scott Michlin.
Good morning, Megan Cullop. It is Friday, the 21st day of January, 2022.
Ooh, so tomorrow is 22-22.
22-22.
But it's 1.
Oh, 1-22-22.
Right. Okay.
Yeah.
It's not as
Don't get
cool.
too excited.
No.
But
February.
yeah, they don't have a lot of twos.
Yeah.
There you go. Welcome. And welcome everybody to our COVID-19 Community Information Program. We are back with you this week, and we have some great guests lined up. In fact, let me show you who is coming onto the program today. Dr. Brad Greenberg will be calling in just a moment. Friend of the show.
Friend of the show.
San Juan Regional Medical Center, a local update on conditions at the hospital. Also, we're going to be hearing from Carol Wight. She's been on the show before, but probably it's been a few months. She is the...
Yeah. It's been a while.
A while, right?
Yeah.
She hasn't been on since like the red, green, blue, turquoise map
That's right.
era, basically.
The era of COVID with the maps.
But Carol Wight is the executive director of the New Mexico Restaurant Association, and so they recently released results of a survey of how the association and the restaurants in New Mexico and elsewhere have kind of dealt during COVID, and she'll share some of those with us and answer some of our questions. So that's what's coming up.
That will be a good interview, because like you said, it's been a while since we talked to her.
It has been.
I'm interested to hear what is happening.
Exactly. And I must say, I'm not going out in person to restaurants as much as I used to, but I am still trying to do takeout and those types of things and drive through. Sometimes that's the level of my restaurant prowess.
You and me both. Yeah. We have similar habits in that way.
Exactly. So anyway, so that's what's coming up on the program. As we're waiting for our first guest to call in, we will start talking a little bit about some of the stats that we have noticed last couple of weeks. Of course, we haven't been here in 2 weeks, so we're back with COVID. And so here's the case numbers in New Mexico in San Juan County. This is actually from the last show that we did 2 weeks ago, right? So this graph should look familiar to you.
It does look familiar to me,
You have a photographic memory.
Oh,
exactly.
Not so much, but yes.
Yeah. So this was through, if you look at the bottom there, for folks who are watching us on video, this is through December 15th, 2021. And then, of course, here we are now.
Oh, my goodness.
This is through January 3rd. That's why I thought it would be good to compare and contrast a little bit. The case numbers are out there. I mean, they're just high. Yeah.
They are high.
Yeah. So this is the average, right? The number of cases per day, 7-day rolling average. And so as you can see, San Juan County, we are now averaging, or at least as of January 3rd, about 300 cases a day. A day.
A day.
And it shouldn't surprise anyone who's watched those daily updates from the state. You know, we were seeing those updates coming, and that's been the whole thing, that Omicron is going to spread really easily, and these may be some Omicron cases, some Delta cases, and so this is where we are. But what we're hoping to find out from Dr. Greenberg is, are all these folks ending up at the hospital? And my guess is they are not. You know, we're not seeing maybe the numbers of hospitalized folks, which is a good thing. People are getting COVID, they're just not getting as sick with COVID, and I'm hoping that is what we're going to find out and confirm.
Let's hopefully we can confirm that with the expert.
Hopefully we can. But we are waiting for Dr. Greenberg to call in, and I think he is doing that right now. So let's let the phone get answered, and then we will put him on the air. And here we go. Good morning. You're on KSJE. Thank you for calling in this morning.
Good morning, Scott. This is Brad Greenberg.
Dr. Greenberg, always a pleasure to have you on the program. Thank you. Megan is here as well.
Hey.
And so
Good morning.
Good morning.
We were just talking about the weekly COVID-19 cases, the 7-day rolling average, Dr. Greenberg, which the state puts on their website, as I'm sure you are aware and have seen, and that the case numbers have increased dramatically, at least in the last couple of weeks, to now about an average of 300 cases a day. We are hoping you can confirm that hopefully not all those folks are finding their way or needing to go to the hospital. Are hospitalizations holding steady or maybe down a little bit, or are you guys still pretty full?
Well, these are great questions, and they're actually we're living through this new Omicron wave, which really is different than previous ones. I mean, and this is it's been very interesting because what we're seeing is an astronomical increase in percent positivity and cases. Now, the question really is, just like you're saying, is does this translate to inpatient admissions? And usually in past waves, what we've noticed is that in the community there'll be an increase in the percent positivity, there'll be an increase in emergency department visits, increase in the number of folks that actually present complaining of influenza-like illness or COVID-like illness. And then that's followed by hospitalizations, which then subsequently leads to intensive care unit utilization and ventilator days. So where we are right now is in the last week or so, we've noticed an increase in our inpatient census, which is kind of creeping up day by day. We've gone up by about 15 cases, and currently what we have in the hospital is we have 46 folks that are COVID positive and 2 persons under investigation for a total of 48. And so this is creeping up. It's not where we were during our previous Delta surge, and we're all keeping our fingers crossed that the community and the burden for the hospital and healthcare infrastructure remains moderate. But across the country, it is somewhat stunning, though, because the Omicron surge, even though it has been like many of the folks and the proportion of those folks that require hospitalization is less, the number of folks hospitalized simultaneously is well over 155,000. And that's increased markedly, over 60% in the last couple of weeks, surpassing last winter's peak by over 20,000 folks. And so we're hoping that across the country that we've peaked, but it is still not clear, and we're somewhat at the edge of our seats.
That makes sense. And so, I mean, I think it's fair to say that there's a ton of COVID burnout, and there has been for a while, but that there's this understanding that maybe Omicron is not as severe in its effects on people. It also seems to be impacting people who are vaccinated. I mean, what is your advice? I think there's a lot of people saying, like, well, whatever, if I get Omicron, I get Omicron. Let's just move on with life and get back out there and do life as normal. I mean, what would you say to those folks?
Well, I think that, our perspective, looking at what's happening throughout the community, is always a little bit different. I mean, we're thinking about this as our community hospital really looking out for the best interests of the health and well-being of the community. So we look at this through what could we do to do better, to keep people healthy, to keep people out of the hospital. And despite the fact that the proportion of folks that get Omicron that require hospitalization is less, there are so many folks that are simultaneously ill that it's still having an impact at the hospital. And so to those folks that are tired, I think we're all tired. We're all tired. But I think that this pandemic comes in waves. And there are times where we need to pay more attention to COVID-safe practices than others in the context of the last couple of years. And right now, despite the fact that we're fatigued and despite the fact that it's challenging, right now is one of those times where we need to be a little bit more vigilant. I do think that those folks that have been vaccinated and boosted, they have considerably reduced their risk of severe COVID, so that's hospitalization and death. But those folks that have not been vaccinated, I believe that they are considerably at risk. And these severe cases are largely among the unvaccinated. We continue with the Omicron surge to have a whole lot of people die every day within the United States. And, we're looking at let me find that number here for you. It's over 1,900 deaths per day. And that's the Omicron surge, which is supposed to be, people believe is not as severe. This is still a significant illness. And I would implore people to, dig deep and use those COVID-safe practices and get vaccinated. And hopefully we'll emerge on the other end, and Omicron will hopefully change the landscape. So hopefully we can finally get out of the pandemic.
Wouldn't that be great, Dr. Greenberg? And I wanted to ask you, too, there was another, I think, milestone in New Mexico announced this week that about 90% of the population that's eligible for a vaccine has at least gotten their first vaccine for COVID-19. Does that offer some encouragement to you and your colleagues in the healthcare system?
Well, absolutely. Anytime we're seeing vaccine adherence, we're seeing folks, really make good choices that are reflective of excellent science and research, which really has real-world, on-the-street implications for what happens with your neighbor, with your friends, with your family, and our ability to get out of the pandemic and emerge from this. So it's absolutely encouraging, and I would just, continue to implore anyone who's on the fence, get the facts from someone that you trust, get the facts from a physician, get the facts from, and make science-based decisions. These are safe, well-studied vaccines. They make a huge difference. They'd make a huge difference to you, to your neighbor, to your friends, to your family, and to our community. So please, let's get this vaccination, and let's try to look towards a brighter future.
Very good. And this is a question that harkens back to, now years ago, but we kept hearing things about herd immunity for a while there. The Wall Street Journal just produced an article that was comparing super immunity to herd immunity. Have you heard about this concept? Can you speak to that?
Well, the super immunity concept has been this idea that folks that have been vaccinated and then also get the infection, they've noticed, at least in laboratory settings with measurements of antibody titers and whatnot, that these folks may actually develop an immunity to, more generalized immunity to coronaviruses in general. Now, it's still kind of in the research phases. I mean, it's somewhat reassuring, especially when it comes to the development of vaccine science. But, the COVID-19 pandemic has just been unprecedented. And we've gone through these phases of what can we do to mitigate this? We go through containment and mitigation. We've gone through these ideas of herd immunity, vaccination proportions, and trying to figure out how to emerge from this on something in a society where collectively it kind of looks something normal, like what we remember from, way back when in 2018. So I think that we're not quite there as far as trying to hang our hats on quote unquote super immunity. I think that the idea with herd immunity is a little bit challenged also because COVID-19 has been demonstrated to not just have one variation, but a series of variants that have now proven somewhat elusive for the vaccine, meaning we continue to have protection against severe COVID, hospitalization, and death, but folks that are vaccinated largely can actually get Omicron. So how we move forward and how we turn the COVID-19 pandemic from something that occupies a lot of space in the forefront of our minds to something that's there but perhaps doesn't represent a daily concern, I think is a goal of everyone. But let's make sure that we land on our feet, that hospitals are still here to care for folks that have COVID or any other issues that are not COVID related, and hopefully we can get back to something that looks normal. I'm excited to see and follow the ongoing and developing science, both the immunologic perspective as well as the vaccine science, hopefully as we can follow this as the Omicron wave recedes.
Very good, and I think all of us are optimistic as to maybe what science is learning from all of this and these vaccines, and just how quickly they were developed with this technology, though it has been around for a number of years, decades, as a matter of fact. Dr. Greenberg, before we let you go today, I wanted to ask you a little bit different topic about flu season, and if you're seeing many cases of flu at the hospital these days, and how that's going, because this is normally the middle of flu season, if I'm not mistaken.
Absolutely true. And, as part of our COVID surveillance, we're following all the influenza cases as well as the cases of respiratory syncytial virus, or RSV. And so we are noticing cases of both flu and RSV, but they are not a large proportion. Our respiratory illnesses are still overwhelmingly COVID. So we're following them. I think we've only had maybe 1 or 2 inpatient admissions for influenza, and we do, of course, seasonally have children that are admitted for respiratory syncytial virus. So, but it has not been, it has not supplanted the COVID-19 burden when it comes to respiratory illness in the community.
Very good. Well, Dr. Greenberg, as always, thank you so much for joining us. It's always helpful to get your expertise and the swarm of information that's always swirling around out there. We just appreciate you coming on.
Well, thank you so much for having me, and please, everyone out there, stay safe, get vaccinated, and continue with those COVID-safe practices, and we're going to emerge on the other end stronger and better for it.
With your help, for sure. Thank you, Dr. Greenberg.
You bet.
That is Dr. Brad Greenberg. He is an emergency medical physician at San Juan Regional Medical Center. He joins us pretty regularly on our program, which we really appreciate. So we thank him for his time.
Keeps coming back.
He keeps coming back.
Somehow.
I know.
We get him to come back.
We're so grateful for him and his insights on all of our questions that we bring to the show.
Right.
Every other week.
Right.
So there you are. Our next guest is going to be calling in soon, and in the meantime, I wanted to share a couple other updates that we've received during the last couple of weeks since we talked to you about COVID-19. There are vaccine clinics scheduled once again with the San Juan County Public Health Office. Again, the Pfizer vaccine for ages 5 to 11 years now, of course, that are now approved. These dates are coming up. So today, this afternoon, from 3:30 to 4, 5 to 11 ages only. Again, on Monday, 2:30 to 3, and on Tuesday at 5 p.m., 5 to 11 p.m. 5 to 11 ages only, pardon me. And so that's what's coming up. Again, you can schedule your appointment at vaccinenm.org, and those are the appointment times that are coming up for COVID vaccines. Testing continues, of course. We've heard about the shortage of tests, but I believe the supply is fairly good here in San Juan County and in New Mexico. We really haven't heard, I think, of too many COVID testing shortages. Maybe the rapid tests, there's a shortage, but not the other ones. A new site to tell you about is on Wednesdays, weekly, in Bloomfield, the North Gym parking lot. They'll be doing curative COVID-19 testing, and so we wanted to let folks know about that. Of course, you go online, and then you can set up your time when they're giving out the tests in Bloomfield, but we wanted to share that with you as well. That's another option to the many COVID testing sites, which we can run through here in just a moment of what's coming up. The other one here in Farmington is also a new provider. This Embry Health has still set up over at Riverstone Church.
Yes, I've seen them.
Right, and that's at 803 North Monterey, so it's kind of in that neighborhood of Farmington, and they're open 9 to 5, Monday through Friday. So again, we encourage folks to check that out. There's also, again, the other PCR tests when available at the Old Tibbetts Library. I think they had a shortage this week, but I think they're expecting more supplies in pretty quickly. Again, Monday through Friday, noon to 7. And they were doing Saturdays and Sundays 9 to 4 last we heard. That's the Old Tibbetts Library there at 304 East Apache Street. Which you enjoy, the fact that the library is still called the library.
I do enjoy that.
Yes.
The library. With
Yeah.
no books.
Yeah.
Just there.
Just COVID tests.
Yeah.
Yeah.
Just COVID tests.
That's what we got.
That's what we've replaced it with.
There you go. Again, Aztec is doing COVID testing at Fred Cook Stadium. That is happening on Wednesdays and Fridays, 7 to 3. Again, you can register in advance, curative.com for our radio audience. McGee Park, of course, that's been the site that's been going since the, very beginning, right? 2+ years. And again, they are doing COVID tests Monday through Friday, 8 to 3 out at McGee Park. And Farmington Schools on 30th Street, Mondays, Tuesdays, and Thursdays. They are doing their testing site at the 30th Street location for Farmington Schools. And so with that, we will go to our next guest, who is also on the phone with us, Carol Wight from the New Mexico Restaurant Association. Good morning.
Good morning. How are you all this morning?
We are well, thank you. Thank you for joining us, and to talk a little bit about how your industry is doing. I think we were just saying it's been a while since we've had you on the program, so really appreciate the update. There was a study recently released to the media about the restaurant industry and how things are faring with COVID, and so I guess just the first question would be, give us kind of a snapshot of how things are going for folks in your industry.
Well, it was a sobering survey. I had hoped that things were getting a little bit better, and I was hearing around that things were lightening up a little bit, but from the survey, it turns out that, there's so many restaurants that still experiencing shortages in staff. They can't get the food products they need and have on their menus. It was just really kind of devastating again to find out that we're really not out of this yet.
Wow. And so I guess talk to us a little bit about that. Is it wages? Is that part of the problem with staffing? I think a lot of restaurants have tried to raise their wages, right, to attract folks back to work?
We're doing everything from sign-on bonuses to increasing wages, everything else, and it's like the people have disappeared. We don't know where they've gone, and it's kind of interesting. Anecdotally, when I was in the middle of 2020 in the pandemic, I had a gentleman from eastern New Mexico call me and say that even if the governor would reopen us, he couldn't open because all of his cooks had gone to Texas. And so how much of it's that and how much of it's just people not coming back and participating in the workforce, we don't really know.
Interesting. And I know that's an issue with other industries too, but surprising that it's also with the restaurant industry.
I mean, it's nationwide and it is industry-wide. I've talked to bankers. Bankers are having the same problem. It's just, again, where have they all gone?
Right. That's been my question from the start of the shortage. Speaking of shortage, what about the supply chain issues? Is this something that's impacting restaurants?
Yeah, over 92% of restaurateurs, 97% of restaurateurs said that they experienced supply delays or shortages of food and beverage items. And again, anecdotally, I was sitting with a group of restaurateurs not too long ago, and they were all talking about the tequilas that they couldn't get. And some of them were the tequilas that were in their margaritas, and it was really affecting sales and other things. So, and that's just one example of things that you wouldn't think of that people couldn't get, and it's not because they don't have the tequila. It's because the bottle makers had forgive the pun, a bottleneck, and couldn't get the bottles out.
Interesting. And I guess, is this the same for local restaurants and chain restaurants, or is the situation a little bit different depending on kind of what your affiliation is?
It may be different. A lot of the chains have their own supply, distribution and supply chains, but they also have the same problems at that very basic level of, you can't get your beef from your supplier if your supplier doesn't have the beef.
And
so everybody's experiencing it. It's across the board. And the other thing that's happening right now, and people don't necessarily recognize this, is the CPI went up. I think it's 5.9%. But two things that the CPI, and that's the Consumer Price Index, inflation, basically that's what we call inflation. But there's two things that are not in that number, and it's fuel and food. And anybody who's bought gas lately knows that fuel is way up, and food prices, wholesale food prices are up about 12 to 15%.
True, very true. And I wanted to ask you too, Ms. Wight, that we hear a lot, and I know Farmington's been working very hard on local food and having a food hub and working with local restaurants maybe to source some of their food locally. Could that be the partial answer to some of these things? I know when things are in season, of course, here we're in the middle of winter, and so no one's really growing a lot of vegetables these days in New Mexico, at least northern New Mexico. But could that be a possible answer to some of these supply chain things when the growing season gets underway, that maybe restaurants will start seeking out local providers for some of these things that they're having trouble getting nationally?
Yeah, and well, as a matter of fact, there's a bill in the legislature, and it has to do with processing meat. And the reason for it is that we have to send all of our beef, all of our cattle outside of the state in order to be butchered to come back inside the state. So there's some things that we're doing that are, will eventually get there, possibly. But again, New Mexico is known for its chili. It's known for its onions. We grow a lot of lettuce, pecans, and you can't make a full menu out of that.
Very true.
So,
I would struggle with that menu. A lettuce base with just chili on top.
Green chili lettuce wrap?
Green chili lettuce wrap.
No.
That's a lot to ask of somebody. So as a consumer, what can folks do to help out our local restaurants? We don't want to see, we had a lot close during COVID they haven't come back. So what can we do to help out?
Just support them. Go and I'm asking everybody this: have patience, have grace. Don't send off that scathing review to Yelp, even if you get bad service. Talk to the manager. Understand that a lot of the employees now are new. It's like opening a brand new restaurant. We don't have our tenured employees, our employees that have been there for many, many years. And so, understand and just have a little bit of patience and grace.
That's good advice, I think, even non-pandemic times.
Yeah.
It is. Well, and I for some reason, because we've all been cooped up, we seem to have lost our ability to be nice to each other, and we've just got to get that back quicker than not.
I agree. Yes, 100%. I agree. Carol Wight, we appreciate your time this morning and the advocacy that you do for your industry. Thank you for being with us today.
Thank you so much for having me on.
You're very welcome. That is Carol Wight. She is the CEO of the New Mexico Restaurant Association, our guest this morning here on KSJE. And we appreciate her coming in and joining us, because that's a whole, I think of all the industries, that's one that really was hit pretty hard during this whole time, especially when they had to shut down their dining rooms and then have limited capacities and things along that line. We saw a lot of restaurants investing in outdoor patios and different things to be able to keep the doors open, basically, and set up drive-through or set up to-go service for the first time probably in their history. They started doing that too. So a lot of changes for restaurants, and they really had to be quick on their feet during this whole time. So there you go. That brings us to the end of our program. How about that?
Here we are.
Yeah, right? But again,
we have to do a count again.
Good information. How long what?
Well, like how many shows? It's time for another count.
Yeah, that's a lot. I think we add them up.
Feels like a lot.
Here we are, but we are doing this every other week, again, and because we still feel it's important to get out this local information from our local doctors, from our New Mexico State folks that have this unique perspective, and so that's why we're here every 2 weeks. But next week we'll be back with a different show.
That's right. Solutions from the street.
There you are. Yes. And that show is all about, in case you haven't joined us before, you can listen to the podcast or watch the videos on YouTube or Facebook, but this is when we find a solution to a problem that really comes from the street. It's not necessarily a government program or not necessarily, it is well organized, but what I'm trying to say, not an elevated program. It is kind of a grassroots solution to the problem, and that's what we're trying to showcase on this program, Solutions from the Street.
Yes.
That was a long,
Yeah.
kind of convoluted explanation.
Yes.
But there you are.
Yes.
But anyway.
Solutions-focused journalism.
Yes, exactly. So we hope that you'll join us next Friday at the same time right here on KSJE. Share this with your friends, of course. It is on social media. It is on Facebook. It is on Podbean. It is podcasts all over the place. So we hope you will share this information, and we will see you next week for Solutions from the Street. Take care, everyone, and stay well. Bye-bye. KSJE is supported by San Juan Regional Medical Center, a community-owned and operated hospital. Here for you when you need us. From emergency care to routine checkups and screenings, caregivers are here and ready to provide the safe, high-quality care you need close to home. Online at sanjuanregional.com with the latest health information and resources to help you live life better here.
Hi, I'm Sam Payne, host of